This quick little video is about IM injection techniques, and this is not about the rights of medications. Also, it's not about dose calculations because my vial has no label on it. So please refer to your own nursing guide when you're drawing up your medications to do dose calculations. But I just want to show you the supplies that you're going to need if you're doing a skills checkoff and how to give an IM injection. So especially if you're using a pad like this. So to do this, you want to make sure you have all the equipment you need. You need 2 alcohol swabs, you need the vial of medications, and you need the type of syringe you're gonna need. You're gonna need a blunt needle to draw off the medications, and you're gonna get the appropriate size needle for giving the injection in the muscle. So I chose a 22 gauge 1 inch, which is a good type of gauge and a length of needle to give in my deltoid, because I'm going to give it in my deltoid. So I chose to give a 1 milliliter. I can choose either a 3 milliliter syringe, or I can choose, if I'd like, a smaller needle. I could use like a 1 milliliter syringe. Either one is appropriate. However, make sure you have the right amount of medications. If I needed 2 milliliters, that 1 milliliter syringe would not help. So I would need a 3 milliliter syringe. So in this video, I'm going to show you how to do a 1 milliliter syringe. So first I'm going to clean off. So I'm going to get one of my alcohol swabs, and then I'm going to clean off the top of my vial. The thing is, I'm going to clean the top of my vial. If I have a cap on it, I'm going to take the cap off, but everything underneath the cap is not clean. So about 15-second scrub, I'm going to clean that top of the vial off. And then I'm going to know that I'm going to pull out 1 milliliter. That is going to be the correct dose that I'm going to be giving to this patient for this little instructional video. So I want to draw the medication up first. So I'm going to open this up. I have my proper PPE on. I'm going to discard things in a trash can, because the thing is that I don't like a lot of trash around me, and I want to make sure I put the syringe on. I don't want to touch the top of that cap. I want to keep things as clean as possible. So I'm going to remove this. If there's like an OK method, you hear that little OK, that means your little hand is in this OK. Double OK means both fingers. But then there's the scoop method. So we're going to talk about that. But I want to make sure I draw up 1 milliliter. So again, 1 milliliter on these syringes. I am going to go to the top of the first black line, which is right there, not the tip of the angle. That's like the little pyramid in there. That is not appropriate. That is not the right amount. So again, that first black line is going to be what I'm going to draw my 1 milliliter up, and I want to inject air first. So I'm going to go at a 90-degree angle. I've already cleaned it. I'm going to push this down, and I'm going to invert the syringe. And I see how the needle is above the water line or the medication line. See that? I'm going to get air. So I need to be below. So I'm going to pull this down a little bit, and I'm going to inject the air, and that's going to help me pull back and hopefully not have any air bubbles in my syringe. If I do have some air bubbles. These are quite large. I may want to pull back more than I need. I also may hold this, and I can use my finger to tilt and get rid of the bubble. Again, I have another air bubble there. I like to tilt the syringe towards the air bubble and flick it. See, it's gone there. And then I push up the medication. There's another one. So you want to get that out. If I need to pull back a little bit more. Again, you want to make sure all the air bubbles, champagne bubbles are tiny little, these are champagne bubbles. The teeny ones in there, you can see the teeny champagne bubbles are fine, but the big air bubbles are not okay. So I've got 1 milliliter. So see the tiny little champagne bubbles? You see those? Those are okay. I'm at the 1 milliliter line, and now I want to scoop. Again, I'm just going to scoop it because I don't want to hurt myself, and then I want to remove this. You want to do this immediately so you do not try to inject, especially if you're in skills and you're trying to inject. You don't want to fail and inject with the blunt syringe. So you want to open up you'll lay this down, and you want to open up your needle. It's hard with gloves sometimes. Take your time. And when you open it, don't touch it. Keep it in the package. Remove your blunt. Put this in the sharps container. Just get rid of this because you don't need it anymore. So in the sharps container, then put this on there, and then take the little safety and push it down. Because if you remove the cap and you try to give this, you're going to not be able to give this. The safety is going to get in the way, and you could bend the needle. So just go ahead and put the little safety back down. Then you can label your syringe with the type of medication you gave. And then doing all your rights, of course, you will be able to then move into the patient's room. So after doing your identifiers and all the things you have to do, when you're ready to give this injection, if you're learning the Z-track method, the thing is with the Z-track method, you want to make sure that you understand that we do use the Z-track to keep the meds in the muscle and not leaking in the surrounding tissue. That's the purpose of it. So the thing is that we're going to try to, if this was the deltoid, we're going to try to move the muscle by keeping our hand here. So I'm going to show you what the Z-track is and how to hold this muscle again using that Z-track method. If you're not and you need to just pinch the skin in the deltoid, you can use that method, but for nursing schools, we treat you the Z-track. So you need to clean the site, and you need to clean it for at least 15 seconds. So after I've cleaned it for 15 seconds, I'm not gonna blow my hand over it or blow on it. I don't want any more germs on that area. Then what I'm gonna do is I'm gonna remove this cap. Again, this is for check-off purposes. When you remove this cap, get rid of it. You do not want to recap this needle. If you recap, that is an automatic fail. And also it's a safety issue. You're really giving medications to the patient. So as soon as I remove it and I'm ready to get rid of it, I need to throw it away. And so get rid of it. It just gets away from you trying to recap it. So again, I'm gonna do the Z-track method. What I'm gonna do is I'm displacing the skin and I'm holding it down. I'm left-handed, so I am going to be giving this medication at a 90-degree angle, and I'm gonna be going straight down. So I've brought the skin back. I wanna make sure I don't poke myself, and this safety is back. So I want to go straight down into the patient. What I wanna do is I wanna hold with this hand, my fingers, and I want to give slowly the medication. And then I'm still holding the Z-track method. Then I'm gonna let it go. I'm gonna take this out. I'm gonna hold it up, and with my thumb, because I'm holding it upright, I am going to engage, click the safety, and let go of my hand. That way the skin from where I did the Z-track will then go right back over from the muscle, and hopefully the medication will stay into the tissue, not leak around the surrounding tissues. I have engaged this safety. This needs to go immediately into the sharps, and then I'm done. Don't rub the area. If it bleeds, you can put a Band-Aid or you can put a piece of gauze over it. But again, don't massage the muscle. And that's how you give an IM injection. Have a great day.